Are you a pharmacist?
Yes, Mr. Speaker.
Okay, let's hear you.
Thank you very much, Mr. Speaker. And let's thank the maker of the statement, the Honorable Minister for Health. Mr. Speaker, each one of us will experience a certain type of pain one way or the other in our life. So the need for a pain medication is critical. So all of us will one day need a muscle relaxant. So the need for us to have muscle relaxant in the system is also critical. But what we are seeing in Ghana, this opioid crisis that is about to hit us to the level that it can be likened to dropping the atomic bomb on Hiroshima and Nagasaki. Mr. Speaker, the Tapentadol, the brand name is Nucynta, that was first approved in the United States in 2008 and 2011, has been in existence. They call it class 2 drug. It's because the level of addiction is even higher than the Tramadol. And it's been in existence and they've been using it. So when you go to the Carisoprodol, which is the muscle relaxer, it's one of the oldest drugs that they have generics on it. They've been using all this while. Mr. Speaker, the issue here is one, this statement should have even been done in collaboration with the Minister for Interior. Because it's not only the health minister's issue, it's issue of export and import. So that is the first issue. If we can regulate our customs and our ports, then we'll be able to find what is coming in and what is going out. Because this active ingredient, Mr. Speaker, could even come into the country as a raw material before it can be produced. It can be used to produce into the drug. So this statement, I believe that we should have the Minister for Interior and the Minister of Health give us a joint strategy as to how they are going to curb this menace. Mr. Speaker, after that, then we will come to what we call the local manufacturing industry. The pharmaceutical industry locally is supposed to be strengthened and be given enough resources so we can start producing these drugs within our country and we can properly regulate it. If we are not allowing, because they are generics, these drugs are not brand new drugs, they are not the original brands of the drug coming from India. They are generic drugs. Sometimes you have countries like the United States, Europe, and others, they're coming out with these new drugs, and we tend to produce the generics. This country has enough aspects that we can build their capacity and build the local pharmaceutical industry with enough resources so we can produce it here. In that case, we can have a proper supervision. When we produce in here, then the issue of internal regulation becomes aspects that we can build their capacity and build the local pharmaceutical industry with enough resources so we can produce it here. In that case, we can have a proper supervision. When we produce in here, then the issue of internal regulation becomes something between the Food and Drugs Authority, the Pharmacy Council, and the Medical and Dental Council, because it's not only the dispenser. We can have the pharmacy dispensing based on prescription. But we have medical doctors who are also will be tend to write these prescription drugs for people who will be using it for improper use. So, Mr. Speaker, this is something that we have to refer it to a committee to have a further engagement on how we as a country we will not go further, because Tramadol, if Tramadol can cause the defect to our country, Nucynta will make it worse. So it's critical that we have a joint statement or direction coming from both the Minister of Health and the Interior Minister, and we'll look at what other countries have done that have dealt with this opioid crisis over the years. We don't have to reinvent the wheel, and I believe we can do a good job. Thank you, Mr. Speaker.
Thank you. Honourable members.